Hello, this is Tristan from Hypnosis New Zealand, and today we're talking with Tony Yuile. Tony is a registered member of Hypnosis New Zealand and an expert in using hypnotherapy in order to treat IBS, which is Irritable Bowel Syndrome. So great to have you on board today, Tony.
Thank you. It's great to be here.
So shall we start with the term IBS? What is IBS?
Right, Irritable Bowel Syndrome. So used to be called a functional disorder, in that when people undergo tests to see what's causing their symptoms, so the symptoms of IBS are abdominal pain that's relieved by going to the toilet, accompanied with diarrhea, constipation, or a mixture of the two. And so people have these terrible symptoms, and yet when they undergo tests, there's no organic or physical cause for the symptoms, which is often confusing for people. The idea of the test is to make sure that people don't have other more serious conditions such as irritable bowel disease. So there's no physical or organic reasons. So what they have kind of decided upon now that is probably due to a miscommunication between the brain in your head and the brain in your gut. So we have an enteric nervous system and a digestive system, which is our second brain. And these two brains are communicating 24/7, 365. And if there's some miscommunication in that some information is not getting through, or the wrong information is getting through, or it's been scrambled in some way, then that has an effect on how our bowels function. And so, they move too quickly, then we get diarrhea. They move too slowly, we get constipation. And as I say, some people get a mixture of the two. And so it's now been sort of classified as a disorder of the gut-brain interaction by the experts in Rome. So yes. And so I guess that's sort of gives a hint as to why hypnotherapy is a good tool for resolving IBS. As we're communicating with the brain, or in this case with the brains, and reconnecting, I guess, that communication line between the brain and the gut, and the gut and the brain.
Understood. Thank you. So why did you decide to specialize actually in IBS?
Right. Well, I've been practicing for about 12 years, and I've been specializing in stress and anxiety and panic and traumas and so forth. And then about 3 years ago, my sister's got Crohn's disease, which is one of the irritable bowel disease types. And I thought to myself, I wonder if hypnotherapy can be used to help people with Crohn's disease. So anyway, I got on Dr. Google and had a look, and there's not a lot of evidence for hypnotherapy with Crohn's, but what I did discover was there's 40 years worth of evidence to show that hypnotherapy for relieving IBS symptoms is huge. There's hundreds and hundreds of papers which all pretty much conclude the same thing, that 75 to 80% of people who undergo a gut-directed hypnotherapy program will experience significant long-lasting results. And it kind of blew me away. I thought, wow, from two aspects really, because it's kind of said to me, well, here's evidence that hypnosis works for the first place, because we've got like over 100 papers, randomized controlled trial papers that say that gut-directed hypnotherapy works, and therefore in my mind, then hypnotherapy works, because I'm just using the same tool but for a different purpose. And the other thing that I sort of discovered as we're doing that research was that 10% of the population globally has been diagnosed with irritable bowel syndrome. And here within New Zealand, I saw one study from a few years back that said up to 15% of people in New Zealand have been diagnosed with it. And there's not a lot of treatment out there for these people. There's a medical route and the diet route, and for a lot of people, those don't produce the symptom relief that they want, and so then they're left with, well, you're going to have to live with this for your life. And yet we've got this tool that's not very well known and not recommended by a lot of doctors, even if they, I guess, know about it. So I thought, well, I've got to do something about that, because it can be very disabling for people. It's whilst it's it in itself can't kill people. It can drive people literally to suicide. The people who are very extreme and have severe symptoms, it really destroys their lives. They just can't go anywhere, and they get stressed and anxious, etc. And so I started to look into it. So I had a look around, see who was training in this area, not just here in New Zealand, but around the world, and went off and trained with them and learned how they, approach this subject, and then based on those sort of learnings, developed my own, I guess, approach to helping people. And so I've been working with people now for 3 years in this area, and it's a very rewarding and satisfying thing to be doing.
Fantastic. Well, actually, on that topic, can you share a few stories or a few success stories of your work with IBS clients? Yeah.
So I would say overall, my results are pretty consistent, I guess, with that sort of 70 to 80% that I mentioned earlier. So, like all treatments, nothing's going to work for everybody. So I've had some people who've gone through the program and then say, well, Tony, not much has happened. I'm a bit, disappointed or whatever. But, that's just the way, I guess, it is. Whereas, the other end, I've had, a couple of people who've said they've been cured. Now, the word is there is no cure for IBS. All we can do is lower the symptoms down as much as we can. And that's what I say to people. I'm not going to be using the word cure. But, so one of those cases was sort of earlier last year, young professional person. Their IBS had sort of kicked off when they were doing their university exams. So stress is also a big contributing factor to IBS. It can cause it, and it can also maintain it. And so they've been a little bit stressed, well, more than a little bit stressed, I guess, doing their exams. And so this has started. And they were sort of 2.5 years into their job, their new career. And basically, it was just beginning to impact on not only their career, but their life in general. They came to see me. So the way that I work, I do 5 sessions, is in the program that I do. And they're spread out over 10 weeks. So we sort of go a week and then another week. And then they get to do some homework in between times and listen to some MP3s. And then they do the next session. And then there's a month between the 4th and the 5th session. So anyway, this person, they came into Wellington to see me. So they're outside of Wellington. And so we did the first session in person, and then the rest of the program was done by Zoom. And in that first session, what I endeavor to do with people is to build hope, and to give them a little bit of background and tell them about that research and how positive it is, and teach them some stress and anxiety relieving tools so that they can go away and practice those before I see them again. Also, I like to teach everybody self-hypnosis, so simple self-hypnosis. So I sort of empower people so that they can do self-hypnosis on themselves again between sessions. And then we did some hypnotherapy, which I think in his case, I think diarrhea. So suggestions around slowing the gut down, healing, etc. And went away. And by the end of it was really good, because by the end of sort of the second session, so that's sort of like 4 weeks, he was already talking about cure, which was like, oh, okay. Now most people see some improvement after two sessions, which I say is about 4 weeks, but this was kind of massive kind of improvement. He was actually already beginning to use the C word then, which is like, oh, okay. And so I think what's a big part of this too is belief, and that's why I do a lot of work around, clearing limiting beliefs about you can't change, because people have come to me, and a lot of people that come to me have had it for like a decade. And as I say, nothing else has worked. They've been told there's no cure. You've got to have this for life. So that's a very limiting belief when I'm sitting there going, well, directed hypnotherapy could actually help you. you know, and they're going, well, I've been told by people, you know, in medical profession that you know, nothing can help me. So I've got to get past that and build hope. So in his case, you know, there's this great surge of now belief and so forth. And so, yeah. And so then we saw, you know, rapid change really over the next few sessions, to the point, you know, where, you know, he put a testimonial, which I've got on my website, you know, saying, you know, it's completely changed his life, you know. It's all gone. Quality of life is improved. You know, he's looking forward to the future, etc. And so, you know, that's what's possible with this kind of work. You know, he was, I guess, at the top end. You know, and then as I said earlier, there's people that, you know, have little change, although, you know, they've gone away with a set of skills, even though their IBS symptoms may not have improved as much as they wanted. You know, they've gone away with some skills about, you know, how to control stress and anxiety and so forth. So it's not like it's been, you know, a waste of time or anything. But most people sort of sit in that middle bit where there are significant results, but that, you know, there's still going to be a flare up every now and again, because, you know, life happens. You know, we're going to get those stresses every now and again, and if they're big enough, then I might just, you know, trigger a flare up. But the thing with that is, it's just a flare up. You know, it's not like the whole thing's kicked off again and you're back to square one. You know, they're equipped with the skills that they need to maintain it. So as part of the program, they get like 8 MP3s, which are tailored to them, and those are there, you know, for them for life. So if they do have a flare up, they can just pick one of those CDs off their phone and listen to it, and, you know, start to get things back on track again.
I was actually going to ask you what can a client expect when working with you, but I think you've clarified pretty much. It's over a certain amount of weeks. So do you want to just briefly say?
Yeah. So it's 10 weeks. So it's spread out over 10 weeks. There's 5 sessions. So we go to the first session, which is 90 minutes, because there's a bit of sort of finding out about the background, etc., teaching them self-hypnosis, giving them a few experiences of what hypnosis is like, and then doing the hypnosis piece. That's like 90 minutes. Then we have a week in between times, and they get their first MP3 shortly after that first session, which they listen to. So those 8 MP3s they have to listen to for 100 days. So they're mixed up over the course of the 100 days. But this is about repetition. You know, repetition is how we learn, and so there'll be suggestions that are repeated in each of those MP3s. And so over time, you know, what we're doing is we're firing off neurons that are wiring together and basically reprogramming the person's neurology. Second session is after that first week, and then there's a 2-week gap to the third session, a 2-week gap to the fourth session, and then there's a month for the fifth session, which is the final session. And that gives us time then to actually note, or them to notice that something's happened, you know, and that change has happened. And then for us to say, okay, well, what do we still need to tweak in that final session, so that, you know, when you go away from here, you're pretty much, you know, done and dusted. And then there's homework for them to do, which really revolves around doing some stress management practices like diaphragmatic breathing, some self-hypnosis practice, etc. Because like I say, you know, they're active participants in this. It's not about me doing stuff to them. It's about us working together, but they've also got a role to play in doing these practices, these homeworks, etc., listening to the MP3s, etc. Unfortunately, you know, I don't have a magic wand and can just wave it, and then they're fixed. You know, they do have to participate in the process, which is all spelt out at the start. Yeah. So and then I'll do a follow-up, you know, sort of 6 months down the track, and if we need to do booster session or whatever, then we can do that. You know, sometimes people decide to go overseas or something, and they just want to, you know, have a booster session just before they go, just to, you know, make sure that, you know, nothing's going to happen while we're overseas or whatever, just in case, kind of thing, which is fine. Okay. And I work for people who are in Wellington, in the Wellington region here. Then they can see me in my office in the central business district. But most of the time now, I'm working over Zoom, which is fine. You know, as long as I can see, you know, a person's head and shoulders, like I can see yours, and it's a well-lit room, then, you know, there's no problem in doing the work. And so I work with people, you know, across the world, Canada, UK, Australia, etc. It's not an issue anymore.
Great. A couple of early mornings, huh?
That is the only thing, Tristan. Yeah, is you've got to get the timing right. Yeah. It's either early morning for me or late in the evening for me. But I'm Mr. Flexible, so.
So yeah, and there's no free lunch. They've got to put the effort in too. It's not just listening to MP3s. They've got to put time in.
And I do. So I do a 30 minutes consult before I accept anybody to the program, and that's to explain this to them, that whatever they've seen on TV, this isn't that really. That it's a partnership where if they're not doing the things I'm asking them to imagine inside their head, then not a lot's going to happen really. If they're just going to sit there and think about what they're having for tea while I'm giving them suggestions about their gut being a river or something, then not a lot's going to happen. But I do really lay it on about the fact that they've got to participate, and that this is more about them really than me. I'm just the guy, the co-driver, but they're the person behind the wheel, and they've got to start the car, they've got to drive the car, and they've got to get to the finish line. Otherwise, we're just going to be sitting there on the start line and going, and I think probably puts a couple of people off maybe. But most people accept that, and so and off we go then they're committed, and
okay, I understand you also have an IBS mobile app, so can you tell us a little bit about that and how they can get it?
So what I've done with that is I've kind of really as kind of a slimmed down, I guess, version of the program as you would experience it if you came to see me. But obviously, whereas the program's tailored to the individual and their specific symptoms, etc., this is more generic. So on the app, there are some recordings that help to calm the nervous system, and some recordings that if you've got diarrhea, focus towards that, and if you've got constipation type IBS, focus towards that. So I think I've got sort of 6 or 7 recordings on there, and then there's some videos as well. So what I've discovered is that whilst a lot of people might be diagnosed with IBS, they don't or haven't had explained to them exactly what it is, or what's the impact of stress and anxiety, for example, on it. So there's some videos there, and I'm adding to those all the time. I kind of explain what IBS is, explain what hypnotherapy is and gut-directed hypnotherapy is, and how we do stress, how we create stress and anxiety. Because, it's true, knowledge is power, I think, and you give people an understanding of what's happening inside of them, and it takes away some of the fear, and also starts to build, well, oh, okay, well, if my body's doing this and I'm in control of my body, then I should be able to stop it doing this, or stop it doing it as badly as it is doing it. And so that's quite a powerful thing. So it's let me see, I've got it down here. Where are we? So you have to go and plug in this URL, I guess, on your phone, which is
what I'll do is I'll put the link to your app, and I guess your website is also the place to go to find out more about you too. So
that's right, so that's www.ibshypnotherapy, all one word, .nz.
Okay.
And again, on there you'll
.nz.
.nz, just .nz. Try to keep it as short as possible. Information about me, information about IBS, lots of information about the research that's behind it, blog posts covering various things, aspects of IBS and hypnotherapy. So it's a wealth of information on there, as well as contact details for how people can book that initial consultation with me.
Is there anything else you want to mention before we close the call?
Just, I guess I've just started in the last sort of month or so, just creating some 1-minute YouTube videos about stress and anxiety and IBS, and so they're on my YouTube Shorts channel. So that's well, I can, if I give you the link, I guess
I'll place it at the bottom of the video. Yeah, definitely.
And so, yeah, I've just kept them to 1 minute. I think at the moment I've got about 20 odds. So, you can gorge yourself on them if you wanted to and watch all 20 of them, or else you can dip in and out of them. But just like little sound bites, really, that build up over time. Again, building that knowledge. And within them, there are also some little techniques too, that I can condense down to a minute. Some breathing techniques, for example, that you can watch the video and then practice those. So
great. So we'll place all those down there. I'm just going to stop the recording now for our viewers, and if you just hold the line, I'll be with you just in a moment. Thank you, everyone. I hope you found this extremely informative. As mentioned, all the information is going to be at the bottom, so you can find out more about Tony, and look forward to seeing you all again with the next interesting interview.